you paying GPs to bolster their clinics on weekends and after hours? Is that confirmed, or is that those negotiations still underway, the vaccine clinic?
So we know the medical benefits scheme is a Commonwealth responsibility, and both the distribution of vaccines to GPs and the payment of GPs has always been a Commonwealth responsibility. I know that the GPs have had some issues as to whether they believe that's adequate. In the hotspots, particularly in Altona North, where we've seen some real fantastic leadership by GPs, we're working with a couple of them to look at how we can demonstrate to the Commonwealth that there are better ways of supporting GPs to ramp up their efforts.
So exactly what does that mean,
Minister?
Well, Mukesh Harkwell, who'd be well known to a lot of you, former president of the AMA, has been able to demonstrate a model of delivery through a GP network, deeply engaged with community, to say we can do more if we get more. So over and above the allocation that he's received from the Commonwealth, we've provided extra vaccine supply to that service and a couple of others to demonstrate that the GPs, if they get more, can do more.
So we want extra supply.
Paying them though, in terms of paying them for the weekends, the original question remains: is the state prepared to pay for the weekend work of GPs?
At what point does the Commonwealth stop outsourcing its responsibilities to the state? That's my question back. There's no question that the GP's payment system is a responsibility of the Commonwealth. In terms of a couple of model arrangements where we've provided extra vaccines, then with that comes extra costs. We are not paying GPs medical benefit schemes arrangements, but we are supporting those GPs in both the extra vaccines, both Pfizer and AstraZeneca, and the meeting some of the extra establishment costs that go with that. But we are not meeting medical benefits arrangements, because at what point do the Victorian government say to the Commonwealth government, quarantining you've outsourced to us, responsibility and support for residential aged care, disability aged care, all of which were going to be done by Easter under the Commonwealth plan, we are still supporting because it's the right thing to do. Supporting GPs to demonstrate that they can do more is the right thing to do. But it all gets back to supply, and the state supply will deliver more as soon as we get it. GPs will deliver more as soon as they can get it. And we are demonstrating to the Commonwealth that the one thing that holds us back, particularly in the north and the west, where there is very strong demand, is supply.
So what do establishing costs mean?
Well, GP, if you look at the Altona North Respiratory Clinic, which is a Commonwealth respiratory support, Mukesh and his team have built up a deeply engaged model with their community that brings forward into the car park and into the wider surrounding area beyond the physical constraints of the building, more people, more facilities, physical facilities, and that brings with it costs, together with the need to exceed the amount of vaccines that he's allocated.
So to paying for the weekends, in other words, you want the federal government to pay for whatever overtime, whatever extra costs there are to get these clinics open on weekends so we can get more people injected.
That's a responsibility of the Commonwealth. It always has been and always should
And you'd
be.
like them to do that?
Yes, we would. And if there's an issue between the GPs and the Commonwealth as to what that payment should be, I call upon the Commonwealth to resolve that.
Minister, you just said, just to backtrack slightly, you said that you'd give them additional supply if they could dish it out, and you'd also be looking at supporting them on those establishment costs to give them out on weekends. Would the effect of those establishment cost payments effectively be state subsidies to GPs to open for longer and do more vaccination? We know you can't pay the Medicare schedule.
We are demonstrating because someone has to, that the GPs can do more when they have their systems backed up and supplied to extra levels. This is the distribution through the primary healthcare network is a Commonwealth responsibility. If we can demonstrate to the Commonwealth through a couple of model examples that they can do more, then I think that's a wise investment, particularly in those areas of the north and western suburbs where there is a disproportionate cases of COVID, and we need to do more in both responding to that and more vaccine. We think that's a wise investment, but clearly primary healthcare networks, GPs, pharmacists are the Commonwealth's responsibility.